Hi, everyone. Give us a minute or two and we're going to get started right away. We're waiting for people to join in. Okay, Nathan, you want to start?
Yeah, we'll take it away. We'll go ahead and get started. So hello and welcome to November's edition of Office Hours. Thank you for taking the time out of your busy day to join us. This latest edition of Office Hours will be looking ahead on how to improve the patient journey. I'm excited to say that we have Angie Shin, our Senior Product Manager, joining us today, and Arthur Loro, our Customer Success Manager. And Angie and Arthur will be taking you through the problems that the patient face. They will also be taking you through the Luma Health design philosophy, the patient journey, and Angie will also be providing you a live demo, and we will then end with a Q&A session. So I'll go ahead and hand over to Arthur and let him take it away. Thanks, Arthur.
Thank you, Nathan. Hi, everyone. Good morning, good afternoon, depending on where you are. So again, my name is Arthur and I'm a Customer Success Manager here at Luma Health. Thanks so much for joining us today. Since the office hours today is about improving the patient journey, we thought it would be interesting to start off with what exactly needs to be improved, right? And to do that, we need to go over some of the problems that all of you and also your patients go through on a daily basis. At Luma Health, we often speak with you about the challenges you see in your workplace and that have been aggravated by the COVID pandemic. We often hear that your staff members, your managers, even your leadership spends a good deal of time in what we call reaction mode, handling inbounds and trying to put out fires, which limits your ability to focus and give attention to immediate patient needs, and also leads to staff turnover and burnout, something that most of you can probably relate to. And at the center of all this, patients are also very busy dealing with the problems brought by the COVID pandemic too, and are struggling to connect with their health systems, often finding it very difficult to get the service they need when and how they need it. So, okay, let's just stop and think, what can we do about these problems, right? We end up hitting a wall, which is the feeling that there's never enough time in the day for everything we need or want to do. We have a pile of tasks and projects to do, endless messages and emails to respond to. And even if we work with focus and no distractions, that's a huge if. It doesn't seem to be enough time. From interviews with you, we've heard over and over again that not having enough time in the day is especially true in healthcare. You've told us that some of the places you're spending most of your time when it comes to engaging with your patients are related to managing and triaging them, properly registering and managing patient charts as they come in the office every day, getting them to properly fill out paperwork and be ready and prepared for their appointments, calling patients one by one oftentimes to make sure that they confirm their appointments. And if they were to cancel them, you then need to work with them to get those patients to reschedule. Struggling to manage inbound call volume of patients wanting to reschedule their appointments is also something very present, or simply needing, maybe just simply needing directions to the clinic, which always leads to this never-ending cycle of a full answering machine and then playing catch up every day. And all of these together, we know can make it really difficult to guide patients in getting what they need and also what you need. Now I want to stop and ask you, are you or have you ever been a patient at any moment in your life? The answer is probably a yes in unison. We are or have been a patient at least once in our lives, right? So we know the feeling of not having enough time in the day too, and the struggle it is to sometimes get the attention and information we need when and how we need it. That said, patients might need to contact their healthcare providers for a variety of reasons: to schedule their appointments, to ask for directions or nurse advice, to get their prescriptions refilled, to check if their insurance plan is still covered, if they have any pending payments, or if they have a medical emergency. And oftentimes, there aren't any other options besides calling. On that note, if we now imagine dozens, hundreds, thousands of patients calling every day to schedule appointments, confirm or cancel them, ask for directions, just to mention a few asks, it's inevitable that there will be a wait time for them to speak with someone. And that's when the waiting game begins. We found that the average person would spend about a month and a half on hold over the course of their lives, when calling their credit card company, maybe their phone carrier, or even their bank. We see that 65% of adults are willing to wait up to 2 minutes on hold. 13% think that no hold is acceptable. And out of those that hang up before getting to speak with anyone, 1 in 3 will never call back. That leads to a huge number of potential patients, clients giving up on a company. We see that more and more, the line between patients and consumers is becoming blurry, if at all existent. As consumers, they increasingly expect healthcare to be as user-friendly and experience-driven as their favorite apps or online shopping portals. They want to be able to schedule appointments, contact their healthcare providers, get appointment information and reminders, and even the appointment itself within just a few clicks. And where are they most probably having that one-click buy experience? On their phone. As you probably already know, patients are on their phones all day long, just like most people, right? And we found that on average, we pick up our phones 58 times a day. One pickup leads to a chain reaction of events. That's to say that 50% of screen time sessions start within 3 minutes of the previous one. All of these leads to an average of 4 hours per day spent on our phones. So they are always nearby and available. A really interesting quote that we found from Kate Huey from IBM Healthcare says that we're in the era of experience and digital, because to drive digital, it has to be about the experience, delivering meaningful, engaging experiences that really help the consumers. And by that, I mean patients, caregivers, the clinicians, everyone. We need to make sure the experience they get is seamless and easy to use, because the technology has to fuel these experiences. Now that we've seen the problem, the challenges, and the current reality for healthcare workers and patients, we want to share how Luma Health can help you meet and guide your patients through their care journey, and also help them get what they need, how they need it. So our mission at Luma Health is needing healthcare can be hard, getting care shouldn't be. And based on that, our design philosophy is focused on 4 main principles so that your team and your patients can really focus on the things that matter. The first one is meet patients where they are. Patients are on their phones, at their houses, on their computers. So by meeting them where they are, you facilitate their care journey, right? Second, make it very simple to communicate with patients in both directions, whether it's with one patient or many. Whether you're chatting with a patient about an upcoming appointment or need to send out a message to 5,000 patients about vaccine boosters and then managing all of them, Luma can help. The third, automate. Help you automate your existing workflows by letting Luma Health do the work for you. So instead of you having to bend and change your workflow, we take your existing workflows and our new ideas and work on automating them so that Luma Health can do it for you in the background. Lastly, leverage. We really want you to be able to get the best of what you already have. We will leverage your existing assets and amplify them. For example, imagine your patients getting what they need right then and there without having to pick up the phone and call you whenever they are accessing your website. Now, I'll pass it on to Angie to go over how Luma Health can help you through the patient journey.
Hi, everyone. Again, I'm Angie, product manager here at Luma Health. My pod oversees all things reminders and patient communication. So we'll walk through a bunch of new features or releases, and then we'll walk through like a bit of a live demo in between. If you do have any questions, feel free to throw them into the chat. We'll get through them as we go. We'll also be monitoring them in case something comes up a lot. We'll go ahead and answer it right then and there. All right, diving in. This is our demo site. I know there's a lot of stuff on here, but depending on your workflow, your business, your site, you'll have different versions of this. This is kind of plugging in all of our Luma features, but I'm just imagining like typically a patient needs to schedule their appointment. At least for me anyway, I start on Google or somewhere else, or maybe someone referred me, and then I need to go on their website, get some information, maybe find their phone number to call and go through that process. And as Arthur mentioned, over half of our phone interactions when we pick up the phone and check it or browse is during work hours. Our bosses probably don't like that, but it just is what it is. And imagine like having to pick up the phone and call somebody in the middle of the workday is very difficult. But if it's on a chatbot or on your phone, you can send a quick text and you can keep answering and engaging in your own time rather than dropping everything that you're doing and having to do that in between. You can see the limit is kind of limitless, I guess. The sky is the ceiling of like what patients can get whenever they want, whenever they need on their terms. But our goal at Luma Health is like, that's not super helpful if everyone on your team has to now take on more work to handle all of this. So how can we make sure patients have this great, engaging, easy to access experience without adding anything extra onto your plates, which I know everyone's got a ton going on right now, more than ever, I could say, depending on where you might be. So here, I'm going to imagine me as a patient. I'm jumping on your website and I'm like, let me get some information. I need to schedule an appointment. And then I notice this little chatbot here. It asks me a question like, hey, how can I help you today? Is there anything that I can do? This instantly grabs my attention or patient's attention because there's no waiting at all. I don't have to click. I don't have to read. I don't have to research. Somebody is engaging with me right in that instant. I don't have to wait at all. And so I'll walk through what this chat experience looks like with the use case of scheduling an appointment. And I'll show you what this looks like in like a live action in a bit, but the first screen here, the intro message says, welcome, how can I help you? And these options down below are fully customizable. You can make them however they want. And each of the options will guide the patient down the path depending on what their needs are. So like COVID screening, for example, will take them through a screening conversation, gathering their information, making sure that they're okay. You could even land on a scheduler if you needed to, if they're having extreme symptoms, or guide them to call 911 if they have a medical emergency. You can add schedule an appointment, which case will walk through right now. Prescription refills, you can route to your medical assistants or other providers. You could ask for lab results, really any top reason why patients call, you can have here to try and handle that without having to go to the front desk or call center. So the way I like to think about this is like a virtual assistant. Unlike all of us, we are not working and we're not online 24 hours of the day, but this bot here, sadly, and poor bot, but they're online 24/7, 365 days a year. It's an extension of your staff. Imagine like if I call the clinic and it's closed, I have to now wait until the next day. I have to leave a voicemail. Am I waiting for somebody to call me back? It's this weird limbo period. And at the end of the day, I'm not scheduling my appointment. Versus here, no matter what time of day it is, no matter what it is, the goal is to get them what they need right then and there, getting that leverage from your website. The traffic is already there, and how can we get the most out of that? And if there are more important cases or things that patients do need to call, you now have more capacity to handle that. So the goal of the bot, though, is to really make sure we're gathering the right information, making sure the patient is doing the right thing, staying on the happy path. So these conversations, the questions that we're asking is really going to be dependent on your workflow. I typically, when setting something like this up, would recommend that we walk through your process on the phone. As Arthur said as well, we don't want you to bend your workflow to us. It should be the other way around. So like if I were to call your clinic today, what are the kinds of things that you're asking patients? What information are you gathering in order to make sure they're booking the right visit with you? We want that same experience online on the chatbot over SMS as well. So I'm asking them their first name, last name. We want to verify they are who they say they are. Since this chatbot is on your website, anybody can access it. We want to do a little verification step before creating this patient and throwing them into your EHR or on the schedule, whatever your process might be there. And then further on the scheduler, once they go through all the questions, they can be as guided as you want, asking like whether they have insurance or not, maybe have they been there as a patient before? Have they had surgery before? Really anything that you like to check off before a patient schedules a visit. And then we'll take all of those answers and then we'll make sure that the scheduler at the end of it is only showing availabilities that match all of the criteria that the patient answered. So for example, maybe they haven't had surgery before and you guys have a separate path for a separate care plan with a different provider than what they originally thought. Or maybe based on their symptoms or based on their past medical history, they'd go down a different path. Or their primary care provider, and we only want to show them visits with their primary care provider. Our goal is really to just guide them through this funnel and make sure, again, they're booking with the right provider, right appointment type, right facility. Because if they don't do that, then all of this didn't really make a difference in that patient's experience or the staff at all. All right, and then after here, in the bot itself, we'll show them a couple availabilities here. These are probably the next 3 that are coming up. We don't want to overwhelm them within this widget. So currently right now, when you open up the scheduler from the chatbot, if it's on the desktop view, it will open up a new tab. This is just for our MVP right now. In a future iteration, we would like to have it all within the bot itself. But just to give the patient enough space to do this and enough visibility into what they're doing, it will open up in a new tab. And then the rest of the flow really takes them through the typical scheduler flow at Luma Health. So it shows them a bunch of availabilities. They can pick a date, they can see what's available. And then once they select a visit, we'll go through that flow of booking it for them. And depending on your account, they may be allowed to book that automatically into your EHR and on your schedule, or you might have an extra step in there to have patients approve or decline before they go in. And now that the patient has scheduled the appointment, what happens after that? So this is also another feature that's available for early release, which we're like to call appointment management. So again, our goal is getting the patient what they need without having to do all of these extra steps and get through all these tunnels to get the information that they need. So imagine here, they're getting an appointment reminder. I'm sure many of you are familiar with this. Most of our customers and our users today have appointment reminders enabled, but the extra kick here is this link that's in the message. So at Luma Health, we like to call this like the taco burrito problem. I don't know if that's used anywhere else, but it's always stuck into my head over the last 5 years or so. Let's say I text you as a friend and I say, hey, do you want tacos or burritos? And my friend says, yes. I'm like, what are you saying yes to? Are you saying yes to tacos or are you saying yes to burritos? There's no way to know besides the most recent information. And so, for example, a patient that has maybe more than one appointment in the same day, or maybe it's a caregiver or a parent that's taking care of multiple patients at a time at a specific clinic. We want to make sure that it's easy to manage and communicate back to the clinic, no matter what you're doing and no matter how much, I don't know, you're responsible for within your journey and other people's journeys as well. So really kind of individualizing each visit. So it doesn't actually matter what the SMS conversation is going like. Doesn't matter if you got 5 reminders before you actually saw it. Maybe you got 2 separate reminders, the taco burrito problem, and you can only reply yes or no to the most recent one. That's gone away now because you'll have a link that's, I like to call like a home for your appointment, that will have all the things that you can do to manage that. So I'll click on that link there. Then I go to my appointment management page here, where you have the option to confirm, reschedule, or cancel. So in our current MVP version right now, we only have the option to confirm or cancel. Reschedule will come right through shortly. But let us know if you're still interested and we can add you onto the list for early release and we'll let you know as soon as those things are ready. But you can see down below, they have all the appointment details in here already, especially if you were to maybe change something. Maybe the appointment had to change a provider or maybe change the suite number or the location. The SMS, if your account isn't set up to like send a reminder anytime the appointment's been updated, this SMS now has kind of stale information that is no longer up to date, but this link will always have the most recent information and update in real time. You can even add a field called special instructions. I know our TSC team works really hard with our users to make sure we can get special instructions for visits within the SMS, but oftentimes that can go on forever. If you have a procedure or if you have a visit that requires a lot of patient readiness, a lot of things that they needed to do before their visit, especially now with COVID, because you have a lot of information on that and those protocols as well. These messages can get very long and very hard to read, and the action items down below are also confusing on what we expect that patient to do. So here in appointment management, all of that can be thrown in here and they can confirm, cancel, reschedule, do whatever they need to do. And then this next step here, I wanted to plug in our SMS masking. So anytime now we can actually mask your clinic phone number. So in the past, we've already had caller ID, which essentially we mask your clinic phone number when we're sending voice calls. So anytime Luma Health calls a patient, it looks like your clinic is calling. So we went it a step further. It's gone through testing. It's ready for GA at the end of the month, where we can now mask your clinic phone number for SMS as well. So anytime Luma Health sends a text message, it'll be from your office number. Patient can actually save that number on their phone. They can text back, they can call it, do whatever they need to do, and always have that ready for them. It'll never be a surprise. Patients won't be getting a call or text from a strange number or toll-free number that they don't recognize. So here we can see, like, now again, patient has a need. They don't need to call in. They don't need to do anything else. They literally just picked up the phone and carried on the conversation here. Like, hey, I've got COVID symptoms and I can't make my appointment anymore. And given our design philosophy over everything, like really meeting patients where they are and focusing on products and features that help us get there, now our staff is now saying, like, do you want to switch to a telehealth visit instead? Our goal is to make sure the patient's getting what they need, and they may need care even if they have those COVID symptoms. So patients saying yes, and I can immediately text back saying, like, great, you'll receive a text within the next 15 minutes. And this will all happen within the next hub experience. All right, and so next here is our staff experience in hub. I'll show you what this looks like in next, but a little preview at first. On the left panel is what it would look like if a patient completed the form or went through that scheduling flow there. You can actually select what questions and answers are most important to you to see here, especially if you're asking a lot of questions. You may not want to fill up the whole chat log with all of that stuff. And on the right side, you can see what it looks like when a patient texts in, maybe irregularly is what we call them, like unexpected patient replies. They're asking for something outside of like the typical automated responses. So it's like, hey, thanks for the heads up. Can you send me directions? Another time I say, I have COVID symptoms, I can't make my appointment anymore. And from here, your staff can message back, assign to staff, mention their team, whatever they might need to do here. All right, I'm going to jump into a demo now. All right, so here in Luma, as all of you are familiar, I'm going to jump into mission control. And as I mentioned, currently our MVP version of ChatBot is built through our form builder. In the future, it will likely have its own builder, its own universe in Luma Health. But for this MVP period, it's going through the the form experience and the form builder, which I'll walk through right now. So here, this is a demo. We have a bunch of forms here. Essentially, any form that your account already has created, built out, you can turn it into a chatbot experience. You can also add new ones. You can do intake versus PS Plus, and then even the things like through our forms, you can build out things for like prescription refills. Maybe the option is prescription refill, but as soon as the patient replies back, our action is to route that to staff. They don't have to actually continue on this big form. So if you are interested in early release, I will walk you through how to set this up. I will likely work with you to set this up with you, and we'll walk through your workflows, top reasons patients call, and any use cases that you guys might have, and really workshop these experiences together and then see what next steps are. So I'm going to pull up this like schedule an appointment version. We'll hit edit. The main difference here out of our form builder is now this field here that says show in the chatbot. All you need to do on any form is select this show in chatbot, and it'll immediately show as one of those options in the widget here. And then down below, you can see these are just question types that we already have in Luma Health that we've now turned into questions. And this is pretty common. I've seen like SurveyMonkey do things like this type form as well, where it just feels more engaging, even though at the end of the day, it's pretty much a survey or a question type, but always needs an exit strategy to still get the patient what they need if they don't fit this happy path all the way down. So here we can see like, what's your first name? What's your last name? This is our patient identifier field. Here you can ask any questions that you might need that guide the patient for their care. Like, are you scheduling an appointment for yourself or someone else? It can be short text, like what's your reason for visit? It might be upload your insurance card. It could be really anything that you guys are saying over the phone. And what we'll do at Luma is really help build that workflow out in this experience and kind of relay all of that information down to here. Same with like COVID screening forms. If I hit edit, this is essentially an intake form of capturing that patient data. And here, all of these questions down below, we're now asking in a chatbot experience. There's jump logic in place here because a screening form, especially for COVID, depending on whether they say yes or no anywhere in the process, you're either going to get asked more questions or you're going to hit a fault and say, oh, you're at high risk or low risk or whatever. So we want to make sure we're respecting this and having like an end state. So depending on their answers here, we can actually reply back with something like, hey, it looks like you've been exposed. Let us know if you need to schedule an appointment or, hey, stay home, quarantine, really whatever process that you guys have in place today. And then now, how does this all translate to the actual chatbot experience? I'm going to show you on a very demo-y website. This is where we test our environment, but this is in production. But imagine this background is your actual website. This is our test widget website. But here is our little bubble here for our chatbot experience. If I pop that open, we can see like, welcome, how can I help you? And these individual cards down below, those buttons, these are the forms that we built out to show in the chatbot here. So one is COVID-19 screening. If I select this, we can see, great, what are your symptoms? I say no, and go through this experience this way. And now the patient is really engaging with your clinic, answering these questions, getting what they need in this manner. I'm going to walk through the scheduler version now. So again, pop open this widget here. I'm going to go to schedule an appointment. Great. Hey, I can help you with that. What's your first name? All right, I'll fill this out. And all of this has validation in between, because again, if we have a free text field, we can't guarantee what the patient is saying and having an exit strategy for it, especially for when it's for scheduling. So for example, I'll put like, what's your email address? And I'll say, doesn't look like a valid email address. Please try again. I'll put my birthday as something for, I don't know. Doesn't make sense again. So it's constantly making sure we're validating the data and making sure the patient is filling in the details in the right way. All right, and here as well, we want to make sure we get the exact address. So we get it from Google, and now we're confirming the identity. So making sure, again, all of this information is correct. I am verifying that I am who I say I am, sending the code. If the patient already exists in your system, this is where we'll capture whether we know who they are or not. So if they verify their code using that contact number and their first name, last name, date of birth, if they already exist in Luma, they'll be created like normal. If they don't exist in Luma yet, we'll go ahead and create that new patient on your end. All right, again, the question that I asked here, and then the scheduler, we can either select here or select more options. And again, this is an MVP right now for our early release. So a lot of like the design and the UI may change a little bit to just make it feel a little bit more alive. So keep that in mind, and we'll keep you guys posted as we make progress there as well. But I'm going to select this option here. And then now I have the option to schedule my appointment. Or maybe I wanted to see more options here. We can see it opens up in the new tab and it shows me all the availabilities here. And I want to make sure I mentioned that this widget here will work on mobile or desktop. So wherever the patient is accessing your website from, they can actually have this exact experience. So on desktop, because the patient has the space for this, we will open it up in a new tab so they can like pick the dates. They can see all the information in an easy way. That said, on mobile, because that screen is not going to change, everything will happen within that window. So we won't actually open a new tab. It'll all happen within that same experience. So once they close the chatbot, they'll be back on your website, versus here, they'll have two tabs open. All right, so I'm going to select an availability. And again, the rest of this flow happens just like our regular scheduling flow, sending an appointment request and here. And again, depending on your account configuration, we may write this appointment back directly. We'll confirm with the patient, hey, your appointment's been booked, or it may be that you need to accept or decline before it goes in. So I'm going to jump back into next here. And now we can see this demo account and set up to approve or decline. So at the top here, we see a card that says, hey, this patient's accepted in the slot. Please accept or decline. I'll hit accept. And now back in our hub, since I'm already a patient, I already exist here. And then this is the form response that we filled out. So all the different question types that we selected to show here, that way I can, or you as a staff user can really get the information you need without having to look at everything else. That said, if you do want to look at everything else, we want to make that easy. So you can actually view all the responses here and see everything else that the patient might have filled out. You might have had 20, 30 questions on there, and we can show however many as you want. And then going back to our chat here, going to Hub. Here, I'll just walk through what these other experiences look like in case Hub might be new to you. Here, we're walking through like the SMS masking and the conversation. Here, patient can really send in anything they want at any point in time. So we call these unexpected or irregular replies. So like, hey, can you send me directions? Great, this is our address. Hey, I have COVID symptoms. I can't make my appointment anymore. Great, we can respond back. It looks like an auto response went out during this demo, but those might happen as well, but you at least have the full history to know the conversation that's going on. You can add internal messages and at your team at any point to loop them in if you need some help. You can send in them as secure or not, send them scheduler links. We want to make sure you can handle everything. And the great part about this is, unlike a phone call, you have to drop everything that you're doing right then and there to call it, or patients are waiting really long, or they get sent to voicemail and they're kind of lost into the universe. But here you can actually reply in your own time, when you have a minute break, when you have time to go back, maybe before lunch, it seems to quiet down and your phones are not ringing as bad. Unless something is urgent, these kinds of things that are not as urgent, you can actually prioritize that rather than spending all of your time trying to fight fires and being in what Arthur called reaction mode. This actually helps your team be a lot more proactive and use your time on the things that really matter. And then next here, this is to show what our appointment management looks like. So this link here can actually be put into any appointment reminder template. Our goal is that any place we have appointment context, you will be able to see this. Oh, it looks like I've already canceled that visit, but just like our screenshot showed earlier, you'll see the options to confirm, cancel, all the information and details below, just as we have here in this mobile view that we have up above. And I would jump into our Q&A now. If you have any questions, please continue to put them into the chat and I will hand off to Nathan.
Thank you, Angie and Arthur, for taking us through the amazing patient journey experience, and for Angie demoing the chatbot. And if you do have any questions, feel free to put them in the chat. We'll give it a minute or two. But otherwise, yeah, thank you again, Angie and Arthur. And yeah, we'll just give it a minute to see if you've got any questions. I know, Andrea, you had a couple of questions, but Angie answered those. Has anybody else got any questions for Angie or Arthur? We've got a question from Matt. Does the new number masking for text happen at the facility level, or is this, or is it one designated number?
Yeah, so right now our GA is for one designated number per account, but our team's actively working on doing it at the facility level. But by the end of this year, likely will not happen, but that's our next project right after this. So we have about a handful of customers that are already live with the single number, and so we're ready to roll this out to whoever's ready. Something to keep in mind though, right now a big step in the process is for that number to work with like their telephony carrier and getting that to be available for us to take over as like the masking. That could take some time. Also, I apologize, Carolyn, I talk very fast. I'm happy to send a follow-up and meet with you one-on-one as well. I apologize, I tend to get very excited and run off into the universe.
Angie, we love your excitement.
I get too excited. I'm sorry, but I'm
Thank
happy
you.
to meet with you as well anytime. Like, I get very excited about this clearly, so I'm always happy to meet with anybody, walk through their workflows, workshop, and walk through all of this again. No problem.
And just to recap, Carolyn, as well, this page and the video will be getting sent out again and will be accessible on the Help Center. And also we will be attaching the slide deck into that Help Center, so you can also go through those again if you missed any information.
All right, so number masking setup. If you're interested in this, please fill out the form for early release. We'll follow up with you immediately since we're very active in rolling this out. Essentially, we register your number through something called like the campaign registry, which whitelists these numbers, because as many of you know, there's a lot of new regulations that have been coming out over the last couple of years of like how we can send blast messaging out over like robocalls and text messaging. So this new campaign registry essentially like whitelists your phone number to be able to send big messages out and helps us make sure that the deliverability is great. So what we'll do is we'll send you a form to fill out. You'll also work with your telephony provider to make sure that we can work with that, and it'll be set up through Twilio, and it won't be the same as caller ID. I know for caller ID, it took a lot of manual work on both ends. That's just how that's working today with Twilio and everyone else, but masking is not like that. Most of the work is done waiting for processing times and things like that. Very minimal effort on your staff or even on the together being on calls and being live and things like that. All right, next question. Are we also able to include a clickable link in the chatbot? Scenario is that patients select what they want, an update on their lab results or request refills. Can we lead them to the clinic's patient portal's landing page? It depends. We can always do that. We can always put links into the questions and the templates. Really, you can put anything you want in the chatbot. Links are fine. There's even a way to like route to open up a new URL. So if depending on their answers, you want to route them directly to it rather than having them click on that link, that's possible as well. Lastly, in our rural area, not all of our patients have phones, email, etc., or they haven't got the knowledge to work with them. Can Luma address this somehow? I think I'll route this up and we can follow up afterwards. I think I have a lot more questions on this, and I'd love to work with you, Carolyn, on how we can improve this for your clinic. I think we can workshop this as well. I think it really depends on your patient population and how this will best work for you guys. I'm happy to set up time another time. We'll reach out after this call.
Well, thank you, Angie and Arthur. I don't think there's any more questions coming, and you did a great job there, Angie, of answering all of the questions. So I think we're going to wrap up the November office hours, and yeah, we will be following up with the slide deck and also the recording as well. So you should see that coming through to your inbox pretty soon. But again, thank you for taking time out of your busy schedule, and have a nice rest of the week.
Thanks, everyone.
Thank you.